So I don't want to be scaremongering any of the listeners, but you must have seen some horror stories and horror cases. What can go wrong with this type of surgery?
Patients are going to come back to see me in a year's time. And if there's a problem, it's me who's going to be dealing with it, right? So it's in my interest to get it right the first time.
Is that like your superpower? Yeah. You can look at somebody and see what their hair would look like in a year's time.
Yeah, I've got a hair transplant goggles, If it's really low cost, it's too good to be true, probably is, right? That applies more to hair transplant than anywhere else. So many people come to me and said, I booked in for the procedure, paid a deposit, turned up on the day and I was shocked at the state of the place. So I've pulled out and now I'm here to see you.
We've spoken about the huge number of Brits that are traveling abroad for these surgeries. Should they save up a little bit more and have it here on home soil? Hello and welcome to the Men's Manual bonus episode, also known as the Men's Manual XY. In these episodes, we take a closer look at the topic from our main episode and get into the nitty-gritty of the science behind it just that little bit more. This week, we're talking about when hair transplants go wrong and what that can mean for the men who've gone through that. I'm your host for today, Manual Ambassador Shaun Stafford, and joining me on the sofa is Dr. Raja, our manual hair transplant surgeon and expert. Dr. Raja, thanks for joining me again. In the previous episode, we had Xander Murray's story about the hair transplant that he had in Turkey and the results of that procedure. And I want to dig a little deeper and pick your brains with some of the more pressing questions that we didn't get to ask. Thanks for joining me again on the sofa. And let's start by asking the question, why would somebody consider surgery outside of the UK?
You're most welcome. That is a very deep question. There's several reasons why they would want to go abroad to have it done, but primarily we know is, of course, the cost that is the main motivating factor. So you have a lot of young men who want a hair transplant, they don't have a means to afford it. And perhaps, they have a budget which is around, £2,000 mark, let's say, right? It opens up the market abroad, particularly Turkish transplants, but that would be the main motivating reason for them to go ahead and have it done abroad. And not just for hair transplants, I guess that applies to any sort of cosmetic surgery, or now we're seeing a lot more dental procedures as well done this way.
In your experience, what's kind of the average age of somebody that would be coming to see you to discuss a hair transplant?
So amongst my patients, the average age for hair transplant surgery is 35 and a half years.
Okay.
Right? So that's, the sort of taking an average of all the different age ranges that we see, but it doesn't exclude people who are perhaps 18, 19 years old. I've done hair transplants for people in their 70s as well. So it's rare for us to proceed with a hair transplant if people are very young, because the chances of progression are a lot higher.
Yeah. And,
what will end up happening is they have the hair transplant, they end up coming back in a couple of years' time for a second one, which is never ideal. So certain cases, yes, if they've progressed quite a lot at an early age, we can consider them. But generally speaking, sort of 30 to 35 is your average, because that's a kind of sweet spot where most of the patients lie.
Okay, so looking at the patient journey for somebody that walks into your office, before you would consider doing a hair transplant, what sort of treatments would you look at?
If they've got a recession at the hairline, almost immediately I know this person's going to be a candidate for a transplant, because there's very little we can do non-surgically to try and actually treat that.
Right.
Once those hairs have fallen out, the only options really are, the only definitive treatment option would be surgery. The only way you can get hair back into that area would be by grafting more, implants into that zone. So we know if they've got recession and that's what's bothering them, then I'd be looking at a transplant, and I'd be looking to see whether they've got a healthy donor area, whether they suit the criteria to be suitable for that. But if they're in the early stages of their loss and there's diffuse loss or it's patchy, the hair's generally in poor state of health, right? Then we'd be looking at things like supplementation, which is really important. So, typically vitamin D deficiencies, biotin deficiency, right? Dietary issues, iron deficiency, anemia, all these things can contribute to poor quality hair. It's a different type of loss though. So we don't tend to see it forming the pattern that we see with male pattern hair loss. So, these are all factors that are running through my mind when I'm doing an examination. But primarily, we're looking to see if they're having typical characteristic male pattern loss. If they are, then we want to treat that with medication to try and stabilize it or slow it down. The combination treatment, medication and surgery is where we see the most dramatic transformation.
Amazing. And digging into the nitty gritty of what actually happens.
Yeah.
When you're on the table in the hair transplant studio, you've got your scrubs on and you're getting down to the actual mechanics of the surgery. Mm-hmm. What do you actually do, and where are these donor sites?
Yeah. So, the typical procedure, let's say, is a gentleman who's needing a frontal hair transplant, right? There's two types of surgery that we do. So there's the FUT method, or follicular unit transplant, which is where we take a strip of skin from the donor area at the back of the head. For strips, it's always the donor scalp, but that strip is then excised and the edges are closed over with stitches. But what happens to that strip of skin is actually that it's broken down under a microscope into individual follicles, and then they're transplanted back in. That is a classical method of doing a transplant. Well, some might say it's the older method. It is the older method of doing it.
Just so I understand, you take a strip of skin,
yes,
and then you kind of stitch it together.
Yeah, so the skin comes out, and then the gap is closed over. So we join the two ends with stitches. How
big is that? I've never heard of this. I thought you just plucked them out.
Yeah, so I'm coming on to that. That's the next one, right? So it varies how big a strip you take.
Yeah.
Depending on the size of procedure, right? But essentially, you want to take the strip from the donor area that's healthy at the back of the head. And you would measure it out to map out roughly to the graft requirement that you need. So, 1,500, 2,000 grafts. You can take a lot more grafts with strips as well. You get higher graft volumes.
Right.
The major downside of strip surgery is that it leaves you with a lined scar at the back of the head, right? So you have this wound at the back of the head that develops into a linear scar. And this is something probably about 5 or 6 years ago didn't bother a lot of patients. Nowadays, it's just completely against the idea of having a remotely visible scar at the back of the head. Now, if it heals well, probably most people wouldn't be able to see it, but you do tend to see the divot sometimes, and it puts people off. So, my case is usually I'd be looking to that option if we're doing a female patient or somebody with long hair.
Because it covers the scar.
Yeah.
Yeah.
But then the other method, which you were mentioning earlier, that's the FUE, or follicular unit excision. And that's where we take individual follicles out. It's a lot more labor intensive. And I think the technicalities of it are you have to be a lot more accurate with your angles and making sure that the follicles aren't damaged in the process.
And so I guess that's where the skill level of the surgeon and the attention to detail and their experience really comes to the fore.
Yeah. And this is something I tell my patients, like, I do the harvesting. I'm accountable for the quality of those follicles, right? Patients are going to come back to see me in a year's time. And if there's a problem, it's me who's going to be dealing with it. Right. So it's in my interest to get it right the first time. Whereas if you've got a team of, nurses or technicians that are doing it, they're not necessarily going to see you again. Right. So this is something that you have to take that into account. And, patients are increasingly more educated about this aspect of it. And I use a high magnification loops when I'm doing the surgery. In fact, I wouldn't be able now to do the surgery without them, because the magnification level is so high. Yeah. It gives me a lot more detail into what I'm doing.
Amazing. And so when I'm guessing face down in a table, like on a massage bed, but on a surgical bed, how long would I be down there for? How long does it take to actually do all of that super intensive work?
Yeah. I mean, you can categorize the procedure split into stages, right? So the stage you're referring to would be the harvesting. And that's where actually you're lying on your front for the first, usually about 2 to 3 hours, depending on how large the case is for an FUE. If it's an FUT, it might be, considerably less time because it takes less time to excise the strip. But once that bit's done with, we'd have you sat up, usually watching Netflix or TV or something.
Yeah.
Right? And, we'd make a start on the implantation, or the, incisions and then implantation. So you have some more local anesthetic injections around the front, and then we start working to get the grafts back in. Now, one thing that's often overlooked is the time frame, right? Because you got to remember, this is like a tiny organ transplant. The longer the organ is out of the body, as in the hair follicle, the less likely they are to survive. So you find with really long procedures, graft viability goes down and it affects the outcomes. So I'm looking to have the procedure start to finish done within 6 hours.
Wow.
And it can be done comfortably and this is why we don't go over a certain graft limit as well, because the more we take out, the longer it takes to get them back in.
Super interesting. Have you ever been performing a surgery and can you see what they're watching on TV whilst you're doing the surgery?
I can hear it usually.
You can hear it. So is there anything where you've given spoilers away, where you've already seen it on your previous transplant patients on screens and you're like, close your eyes now, something scary's coming up?
No, I tell you what does happen though. There was a documentary on Schwarzenegger that came up on Netflix recently.
Yeah.
You probably will have seen that. And, I had about a really busy week. There was a patient every day. And almost all of the patients picked this documentary. And I'd get about halfway into it. And then obviously, my bit's done, right? We finished the procedure. And I'd seen the first half of the documentary about 7 or 8 times, right? But I never got to the second half. So I'm still meaning to finish it off. It's weird. Yeah.
Part of your pre-surgery notes, you need to set them the homework to watch the first half of the of the Schwarzenegger doc so that you can then watch the second half.
Exactly.
Or listen to the second half.
Listen to it, yeah.
Whilst you're plugging the holes back in.
Exactly. So it's always, it's there in the background, but actually it's an amazing thing to have for the patient because you tune into something, it takes your mind off it. They're under local anesthetic. They can't feel what we're doing. Usually, if they do, then we just top up the anesthetic.
Yeah.
And patients come away from that. And actually, what I find is in the city, a lot of guys are like, this is the most time I've had to myself for a long time.
Yeah.
Because they have time to think and they have time to just, relax. So it's actually quite therapeutic.
It's one of the things why I love long haul flights.
Yeah.
Without my kids' preference, because it's one of those ones where you do get that 6, 7, 8 hours to yourself where, there's usually some benign entertainment that you can listen to, but there's no phones, there's none of that sort of stuff. So you actually get some time to sit and just be. When you're doing the surgeries on your patients, when they walk in versus when they walk out, what's the difference in their energy levels and sort of expectations of what the surgery is going to be? Are they walking in scared?
I wouldn't say scared. I would say nervous, right? Most guys are, or people. I mean, we treat female patients as well, right? But most people are nervous when they walk in. And actually, the first sort of half an hour is just me talking through how it's all going to go, and discussing. We got to get the hairline right before we do the procedure. That's really important for me because. The patient's got to feel comfortable with what's happening.
Yeah.
And, there's some approaches to it. I know patients have said to me in the past, they've had transplants before perhaps, and the line was drawn for them. They didn't really have an opinion or a say in it. And it was like, well, this is what you need. And, I think it's best for you or whatever.
Yeah.
It's not like that. This is a conversation between the patient and myself. And it happens largely in the consultation. We agree. And, usually there's a tendency to want the hairline quite low. Right. From you or from them? From the patient. Okay. Yeah. Because they have unrealistic expectations. Maybe they've seen a lot of things on social media, etc. And there's a lot of education that goes into that side of things and say, actually, you know what, it's not going to look natural in 10 years' time, right? So we have that negotiation, that discussion in the consultation. When they turn up on the day, we will do it again. And we'll make sure they're absolutely happy with everything before we start. So we're off to a good start because a patient, when they've seen that line, they're already excited, right? And, they come away from it feeling relieved a lot of the time. That's what I've seen. Often, I've had patients in tears at the end of the procedure. I'm not quite sure why they're in that state, but this is something that they've been dealing with for several years, right? And, there's a sense of satisfaction that comes from addressing that problem. Yeah. I think they come away feeling really good. Huge release of emotion as well, right? And relief. A couple of my friends that have had sort of hair transplant surgeries, I kind of get the impression that you put the hair in and then
a week or so later it falls out, but then it grows back through. Is that a right understanding, or is there more to it than that?
Yeah, I mean, the vast majority will experience that. And what they go through is actually the implants, when we insert them and they heal, so they'll form into tiny scabs, right? And often in the first 2 weeks post-op, these scabs will shed. Sometimes they'll take a hair shaft with them, right?
Okay.
It doesn't necessarily mean the graft has fallen out, which is a common misconception. But, once the scabs have shed, you'll actually see the hairs implanted in the skin. So they'll look at it in the mirror and actually say, oh, I can see a hairline now, even though it's faint, right? And then they go through this shedding where it all kind of falls out. The vast majority of guys will go through this. And they go through a panic at that point, where they think perhaps it's failed and it's not going to come back. But then what you find after that is you get these fine hairs coming through. We gradually get thicker and thicker, sort of 3 to 6 months from the transplant. And then, so I like to see people at about 6 months because I want to see things are going in the right direction, but I'm not judging the result at 6 months. And then when you get to 12 months, considerable improvement. And then sometimes between 12 and 18 months, we see a good improvement as well. So if I'm not content at 12 months, I'll bring them back at 18 months to have another review. But basically, yeah, you do go through shedding.
And that's what most people are experiencing. Because to be fair, all of the friends that have had hair transplants where their hair's fallen out, quote unquote, they've got a full head of hair now and it looks great. And that's, as you said, 12 to 18 months later and it's kind of thickened out and as it should be, I guess.
Absolutely.
So now that we understand a little bit more about the actual logistics and sort of actions in the surgery, does that differ sort of depending on where you are in the world?
Absolutely. I have traveled to several different countries, and seen different methods of how the surgery is done. I've seen how it's done out in Asia. It's a completely different thing. I mean, largely the concept's the same, but the methods are different. And, one thing you'll find is, and this is why Turkey is interesting, you see, because Turkey's in the middle of all of this. So they deal with both worlds, right? Somebody who's come from, like a Middle East, for example, or South Asia, their concept of what they want from a hair transplant is different to general, typical British man, right? I think in Britain, we're very focused on the details, right? So my patients will usually say to me, listen, I don't want people to realize I've had a hair transplant, but I want to fix this problem. Yeah. And it's got to look natural, right? So they have quite high expectations, and within reason, of course, we can deliver to that. But somebody from, one of the Asian countries or Middle East, they might have different expectation. They usually present when they're almost completely bald. Yeah. Right. And they've been mulling it over for some time and thinking, actually, I want to do something different. I want a hair transplant. Right. And then that's why they end up having huge procedures like 4,000, 5,000, 6,000 graft surgeries. Because they're, the mindset is, well, I'm going to fix this problem and I want it done properly and I want it done in one session. And this is, it's just very different to what people in the West want. Generally speaking, I mean, I would say in America, it's also a very similar mindset. People tend to address these things quite early. They're quite conscious of them early on. And, they're very focused on the minor details.
So when it comes to the different, not necessarily cultures, but different sort of genomes, so would a Westerner's hair be different to an African's hair, be different to an Asian's hair? And does that impact what you can do from a surgery point of view?
That's a really interesting question. So, I've seen male pattern hair loss in all ethnicities. Yeah. And I've seen it manifest in a very similar way. I mean, it's very typical. But the differences are in the quality of the hair, generally speaking, right? So, classically, Afro-type hair is quite difficult to treat with hair transplant, particularly with FUE, because of the complexity of the procedure, given that the hair is quite curly and difficult to extract. But they do experience hair loss in the same way, the same pattern, right? Whereas, Caucasian men, you tend to find the hair calibers quite fine in comparison with South Asian population, which have quite thick hair. So yeah, there's subtle differences, but the pattern of the loss is very similar amongst all of them.
So when it comes to the hair transplant procedure, what is the most important stage of that surgery and why?
As I said, there's 2 or 3 different aspects of the procedure where graft handling is the key, right? So extraction for me is a critical part of the procedure, and usually I will start with the extraction. Sometimes we do the incisions first, so we have a better idea of how many grafts we're going to need, and they're quite sort of niche cases. But the most important thing is graft quality and viability, right? That's the first thing, and that can only be preserved if they're extracted carefully, they're sorted carefully, which means that the assistants that are working on the case are really important as well, right? Which is why I only work with a handful of assistants I trust and I've worked with for several years now. And they're going to be handling the grafts. So, good technique in handling is really important. And then the other aspect of it is actually the implantation. So largely you can break this down into 2 parts. The extraction and the implantation, the angulation of the hairs is really key, because you've got to try and reproduce a natural line, natural result as much as you can. And you do that to some degree by replicating the existing hair, but also by making it not perfect, right? So not a straight line, lots of variations, and asymmetry is important. Sometimes we draw a line and the patient will be like, well, it's not symmetrical. I say it's not supposed to be. We want a bit of asymmetry to give you a natural look. So I think the most important aspect is a consultation, actually, not the procedure. Because I know from a consultation, before I've even done the surgery, whether the patient's going to be happy or not. All right? Because you know what their expectations are. You know that if they're going to be reasonable with their expectations, I can see what the hair transplant is going to look like in a year's time. So my consultation is gauging, is this gentleman going to be happy with that result?
Is that like your superpower? You can look at somebody and see what their hair would look like in a year's time.
Yeah, I've got a hair transplant goggles, I can see
There's a filter on your phone where you hold it up and it shows.
I wish there was. That would make things, there's some software out there that does it, but I think it's a bad idea, because then if you don't live up to that, they're never going to be happy, right? But I know which way it's going to go, and I gauge that in the consultation. And, coming to what we were discussing earlier, if I don't feel I'm going to meet that, expectation, we just don't do the surgery.
Interesting.
I don't think, I wouldn't go into a surgery knowing the patient's not going to be happy. Might be a good result for me, right? I might look at it and think, actually, I'm really happy with this. But if the patient's not going to be happy, then there's no point for us to do it, right?
So after the surgery, what are the most important things that the patient needs to kind of follow through with when it comes to aftercare?
I think the most neglected part of a hair transplant is the aftercare.
Right.
And patients of mine who've had bad experiences have said they felt like they were abandoned and left to it. So, our process is, that you sent the aftercare instructions well before you have the procedure. In fact, on the day you book, you get sent all of that information. But I will go through that with the patient personally, what the aftercare process is. And the first 2 weeks are quite, I wouldn't say intense, but there's a lot to do in the way of washing, cleaning the recipient area, etc. But as long as you follow those instructions, there's nothing more you need to be doing. And so the good thing about this is, usually they'll take a couple of weeks off after the procedure, and they're free to do their day-to-day activities, right? As long as they follow the aftercare. My patients usually wake up the following day, they won't have any pain or discomfort, and they can do their day-to-day stuff, which is amazing in terms of, like the previous, the FUT surgeries we talked about, the downtime is longer, because there's stitches and it's a deeper wound. Yeah. But with the FUE, the recoveries are remarkable, really.
So I don't want to be scaremongering any of the listeners, but you must have seen some horror stories and horror cases. What can go wrong with this type of surgery?
Well, thankfully, when it's done well, right, it's a very low risk surgery. And procedures only work if they're followed every time, right? So as long as you stay within limits, it's a very safe procedure to do. However, we have seen cases, usually, abroad, where the conditions are poor, where patients have developed an infection. That's quite a sinister infection. There was one patient in India, I think, a few years ago, who unfortunately died during the procedure. But we don't have much clarity on what actually happened. It's like a 12-hour surgery. What was going on. But generally speaking, if it's not a sterile procedure, So there's no need for it to be a completely sterile environment, but you need to have a sense of hygiene in the procedure and the way it's done. Single-use instruments are ideal, right? We do sometimes use reusable instruments. Of course, they're sterilized, etc. But, as long as you stick to protocols, everything would be fine. But you would worry about things like infection developing, which is, why we sometimes give antibiotics as post-operative prophylaxis. But also they can develop a condition, extreme cases, something called necrosis, where the tissue actually dies off, right? Yeah. And I think there's one case of that documented worldwide, and that was, again, in quite mysterious circumstances, but probably like a backstreet clinic, right? But generally speaking, I think, as long as people have done their research and they're going to a decent clinic, it's a very safe procedure.
And I know that we spoke about in the main episode when Xander was telling us about his experience, and he actually, in hindsight and with retrospect, he thinks he got away with it because he has an underlying heart condition. And part of the process for him, at least, was to have, adrenaline injected into him. Are there any things and situations like that people should be aware of sort of thinking about having a hair transplant?
Absolutely. I think, part of that is our responsibility to do a thorough check beforehand. And, I've in the past seen clinics where these checks are perhaps not as thorough as they should have been. And then I've worked in clinics where it's, the patients had a very thorough workup, and I've learned, it's essential part of practice, really. So all my patients will have to go through that process. And, sometimes patients don't tell you. This is the thing, they don't mention it in the consultation, but, if we order a GP summary or something, it'll be something on there that would potentially put them at risk. So I think, those details are really important. But, coming on to things like adrenaline and what we actually use while we're doing the procedure, it's largely local anesthetic injections. And I also inject adrenaline. And the purpose of that is to reduce the bleeding, largely, because adrenaline causes blood vessels to shrink down. But what we find, in particularly going back to Xander's case, is, in Turkish clinics, they generally tend to use a huge amount of fluid when they're doing this procedure, which, I've never felt the need to do. I think, probably it makes it easier for them if they're doing larger procedures. My patients are very conscious about swelling. They don't want people to spot it. They don't want to be seen to have had a procedure. Yeah. So I tend to use a stronger anesthetic, but much less of it, to counter that problem. And thankfully, they don't really have swelling. That's obvious at all.
So if somebody is seriously considering hair transplant surgery, what would be Dr. Raja's checklist for things to walk themselves through?
This is a really important thing, right? And we talked about due diligence earlier, but I would say the first thing is, if it's really low cost, it's too good to be true, probably is, right? That applies more to hair transplant than anywhere else, right? But always do your research on the clinic. You'll be surprised how good clinics look on paper or online, but when you actually turn up for the day, right? I've so many people come to me and said, I booked in for the procedure, paid a deposit, turned up on the day, and I was shocked at the state of the place. So I've pulled out, and now I'm here to see you, right? So make sure you actually check the clinic out and look at the reviews, although there's a lot of fake reviews for a lot of places, as you can imagine, right? But speak to patients perhaps that have, somebody who's had the procedure is the best thing, right? Because they'll tell you what it was like, if they were happy with it, etc. The surgeon who's going to be doing it is key. You got to know who's going to be operating on you. And, there's nothing wrong with somebody who's, let's say, relatively junior, as long as they're doing things within their limits. So they need to have a sense of, I'm comfortable doing this. I'm confident I'm going to get a good result. But then there's, people who will just do anything that comes through the door, right? And that's not right. So it's very hard to gauge that. And what I would say to patients is, go and see the surgeon who's going to do your procedure, sit with them, discuss it with them. And a lot of that communication is non-verbal. The patients, they need to feel reassured when they're speaking to the surgeon. Then you think, right, this is the guy who I want to do the hair transplant for me.
And should you walk into that consultation with almost a short list of questions to ask, how many follicles you're going to be removing, and kind of have an understanding of what what is the norm, so that people aren't over-promising and under-delivering? Is it that the surgeon is an expectation that the surgeon would be doing the harvesting, or somebody that's really experienced would be doing the harvesting? What other things should they be asking in that consultation?
I think, most patients will have a list of questions, and, they've done a lot of research. There's a lot of stuff online, although that can sometimes cloud the picture for them.
Yeah.
Right. So, they'll ask me about the particulars of the procedure. They'll ask me how many surgeries I've done. And, that's a very good question to ask, because it gives you an idea of experience. But I think mindset of surgeon is really important. Experience, as long as they're doing things that are safe within reasonable limits, it's they'll have a reasonable level of experience if they're in the industry and they're known, right?
Yeah.
But again, you need to be confident that they're addressing your goals. So I think there's a bit of push-pull with the patient to make sure we get to where we want, right? Like discussing hairlines, density, etc. But if you're not on the same page, then you shouldn't go ahead. And that applies for the doctor as well as the patient, right?
Absolutely. And last but not least, one of the major things about this conversation is when hair transplants go wrong. And, we've spoken about people going abroad and the huge number of Brits that are traveling abroad for these surgeries. In your opinion, should they save up a little bit more and have it here on home soil?
Well, what I would like to say is that I do feel sorry for some of the surgeons perhaps out in Turkey, because I'm sure there's some good guys out there doing some really good work as well. Yeah. And it's sort of, the whole industry sort of cast a shadow over their work. And this is happening to us in the UK, so I can sympathize with them. There's nothing wrong with traveling abroad for the surgery. But what you'll find is places like Turkey, the similar standard of surgery that you'd get in the UK, the price point is about the same. So the clinics are, doing the same style of surgery that I'm doing. You'd expect the price point to be very similar. So it's almost not worth traveling there. You'd rather have it at home. But the single biggest, the important factor for patients is actually, and they all say this, the ones who don't go out to Turkey in the end, they say, I didn't want to go out there because I want to be at home in case there's any problems.
Yeah.
Right. I've had patients who've gone out there, had their head shaved, ready to have the surgery, and then they just run out.
Yeah.
Because, they're speaking in a different language. They don't feel comfortable. They feel like something goes wrong. What's going to happen? Whereas, if they're in the UK, they know the NHS is available, right? If there's any issues, anything severe or anything urgent, we can always address that. So they have the reassurance and of course, if there's any long-term complications, I'm always available for them to see.
Yeah.
So yeah, I would say, there's nothing wrong with going out to places like Turkey, but unfortunately that it's medical tourism has developed so much that it's all about low cost, high volumes. And if you're interested in getting a good result, you need to really focus on the surgeon and the clinic that's going to be doing it for you.
So that is it for another episode of our Men's Manual bonus series XY. Thank you so much for listening to this bonus episode all about when hair transplants go wrong. Dr. Raj, thank you so much for explaining things so brilliant to us. And also, I'm sure a lot of the people listening back home have really loved your insights and found it as fascinating as I did. So thank you so much for being here.
Absolute pleasure. Thank you for having me.
If you did enjoy this episode, be sure to like our reels, turn on your notifications and subscribe to the podcast, giving it a review or rating, as this really helps the success of the show and allows us to grow our community and keep us having these conversations. I've been your host, Shaun Stafford. This has been the Men's Manual XY, and we look forward to seeing you all again next time.